Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to Helping Seniors TV. This is the program that's designed to inform, educate, and connect you to resources that are going to make a difference on your own aging journey. I'm Kerry Fink, Executive Director with the Helping Seniors organization. We were founded 15 years ago by a gentleman named Joe Steckler. He's a retired Navy captain, and his last command in the Navy was the Navy's Gulfport, Mississippi retirement home. And even though in his early life he had driven subs all over the world, worked in the Pentagon, things like that, his role in that Navy retirement home really gave him a lifelong passion for all things seniors. And when he and his lovely wife retired here to Satellite Beach, Florida, he established Brevard Alzheimer's Foundation, got to working on all things that were necessary to help families navigate the situations that they would face with cognitive abilities. And then when he retired from that, Joe just couldn't stay retired. And so 15 years ago, he founded an organization called Helping Seniors Brevard. And that organization operates the county's Senior Information Helpline, which is a free call at 321-473-7770. I'm going to say it again, give you a second to grab a pencil, but 321-473-7770. And on that line, we get 4,000 plus calls annually about everything you could imagine: housing, legal, medical, financial, transportation, you name it. We get the calls on it. And because of that, we've learned that there are things we can do. Joe called it making an aging plan, but there are things that we can do that help us prepare for the journey of things that we would run into along the way. And we call it getting your ducks in a row. But here's the point. There's a lot of really good help out there, but until you take the time to learn what's available, it's not going to be able to help you. You're still in charge. You decide whether it's going to be useful or not, but at least take a minute to learn what's out there. And this is a topic that we're going to cover today that we don't talk, I think, enough about. A lot of times when we talk about senior wellness, we are talking about, is a knee replacement right? Is a hip replacement right? What are the things that are going on with us medically, physically? I need to take better care of my heart. All those kind of questions, very important. But when we neglect how we are doing as people, we're missing half the equation. And so we have a couple of really wonderful folks on the TV with us today who are experts in this. One of us is a great friend of the Helping Seniors organization. Her name is Tami Leeberg. She's an ARNP and board certified geriatric nurse practitioner. Welcome, Tami.
Thank you. Thanks for having us.
Yeah. And we have Alex Thorpe, who is also with Senior Solutions Mind and Body. And you have a tremendous background in all things as it has to do with psychiatric care for seniors. Welcome to the show.
Thank you, sir. Thank you for having me.
Yeah, I wanted to start by asking you a question, Tami, because you have a background of serving seniors and their families through what I would call traditional medical practice. You have functioned for years as somebody's primary care physician. You're able to visit them where they're at and walk them through all the things that they need medically. How did this become important for you to establish an organization like you have now that is also investing into making sure seniors' mental health is good?
Well, we have, and thank you for having us today, Kerry. But medically, you have a lot of different people that look at your medical history. And like you said, they take care of your heart, they take care of your lungs, they take care of, and as a primary, when I decided to open up Senior Solutions, I wanted to fill that gap that was needed. Especially working primary care and assisted livings for as long as I did. The one thing that was overlooked or not looked at enough, I felt, was the mental health of that geriatric patient. Because sometimes it's, they're from the very stoic generation. They don't complain a lot. And if they do, then you really are in trouble.
Yeah.
So everything is always fine. Everything is always okay. But it wasn't. They could not be sleeping, or they could be having heartburn at a certain time of the day. And it always maybe was around something that you don't know unless you get into the mental health of that patient. And they may not even know it themselves. They may not be sleeping because their brain won't turn off, and that's anxiety. And there's so many things that a lot of primaries, me included at first, it's like, oh, well, they've moved, they've had this huge, this huge transition in their life. They've given up their home of 50 years, and now they're moving into a facility where people are telling them when to eat, when to sleep, and it's a difficult transition. And so we're like, oh, well, obviously they're going to be depressed. Let's put this on this medication, or and then all of a sudden, that affects them medically, or it doesn't seem to help, or there's just so many things mentally that they have to adjust to that they may not know themselves that's needed, that as a primary I saw was needed. So that's the reason, that's when I decided to open this up and reach out to Alex, who does do that psychosocial mental health piece that was missing. Because I can take care of you medically. I can look at your meds and adjust them. But to do that psychosocial with the tools that are given to us to address these things, to see exactly, well, is it depression, or is it anxiety, or is it true insomnia? And that's what he can do.
Alex, we had just not so long ago recorded a program with Tami called Transitional Care. And we were talking in the body of that program. One of the topics we got into was the fact that she is able to do memory assessments. And it was fascinating to me to learn that memory assessments include looking at depression and things like that. I didn't realize, as a person who doesn't understand this the way you guys do, I found that surprising. But then as you were explaining, it's really part of the whole equation.
Yes, sir. We utilize certain scales to assess for the depression. There's a PHQ scale, and there's the GAD. GAD is a generalized anxiety disorder as well that we use. Like Tami had made mention, transitioning from the hospital to an assisted living facility, or at times, perhaps the individual is already living at an assisted living facility and has to transition to a memory care unit, can cause a lot of anxiety and a lot of depression. So we perform what's called an initial psychiatric evaluation. And we utilize the DSM-5 handbook, and there's certain criteria. We ask the questions, and we help that person transition. We also look into helping the family. At times, the family can have a lot of guilt. We are blessed. Tami has established many relationships in the majority of the ALFs and Brevard County. So we have a lot of resources to help the individual as well.
I was thinking, because you guys did a great presentation at our Senior Resource Center where you guys were talking about this. And one of the things that I heard come up that was a little bit surprising for me is we always are thinking about the senior themselves, but you were actually also talking about that this can affect the caregiver. So because you got many times it could be two people living in that household, right? It could be the person who's being medically treated, but then there's this person who's really being called to task to try to be that caregiver. And yet you have an ability to really work with each of those at their own level where they need to be.
Yes, sir. Yes, sir. We also, at Senior Solutions, we also offer therapy, cognitive behavioral therapy, interpersonal therapy, and family therapy as well to help with that transition.
Yeah, I was asking the question. I said, I do remember, we were caregivers for our mothers. And I remember in my mother's case, the doctor did put her on some kind of antidepressant, but it was almost like it was an afterthought. Okay, we have the blood pressure pill, we have the cholesterol pill, we have all these things that she needed to take. And oh, by the way, she's probably depressed, so let's give her this. You're able to really drill much farther into that than maybe your primary care physician really has the time to, because as you know, you're fortunate if you get 8 or 10 minutes of actual doctor time. And, most of the times the situations really could benefit from a little more time being spent on it.
Yes, sir. So we really dig and drill down deep on mental illnesses, depression, and anxiety. There's a medication class called SSRIs. It's called selective serotonin reuptake inhibitors. So when someone's going through depression or anxiety, I can show you. In the back of my hand, let's say, for example, is a neuron, and these are the dendrites, and they connect. There's chemical messengers in between, like little particles, neurotransmitters. And at times, the serotonin, it needs to be there so the person doesn't suffer from depression, but it can be reuptook too quickly. So you can introduce like an SSRI, Zoloft, Lexapro to help. We always, our practices, we always start very slow and we monitor the individual. SSRIs take about 10 to 14 days for therapeutic effects to happen. We like to follow up in 14 days and then perhaps in 30 days. And by no means are the medications lifelong, but they do help in certain stages, like the transition stage.
Well, one of the things we were talking about before the show, which was fascinating to me, was also the fact that you guys are able to kind of look at the whole person. I guess that's probably why the company is called Senior Solutions Mind and Body. And we were talking about the effect of sleeping properly being in there. And you said, so a lot of times you're able to look at all of these things and kind of come up with some recommendations. Like Tami Leeberg, you said early on, and I think it's true, you know, they used to call what the World War II generation, they call it the greatest generation ever. And they were always taught, you know, suck it up, don't complain. And yet still all that has to go someplace. And maybe it's translating into I can't sleep well, or I've got anxiety. And then you guys are able to actually talk to people and figure out where they are and what's going to help them best.
Absolutely. Sleep is a priority. We question the individual whether or not they're having difficulty initiating sleep. Perhaps they wake up with anxiety and they have intrusive thoughts or racing thoughts and they can't fall back asleep.
Mm-hmm.
So we really drill down on sleep hygiene, not having a lot of stimulus before you go to sleep, caffeinated beverages. Sleep is a priority. Yes,
yeah.
A lot of depression and anxiety can stem from lack of sleep.
What about the nutritional component? Like if you're eating, maybe not. I was telling the story on my mom. It's easy for me to do because we would load up her refrigerator with everything good. You know, here's some nice blueberries, here's some nice strawberries, but you would always gravitate towards a slice of bread and throw a piece of American cheese on it. And that was always her go-to, like comfort food. I don't know a better way to put it. And we were always concerned, are we nutritionally harming her? We're giving her we try to make everything available, but the only thing that would get eaten out of the refrigerator would be that slice of bread and cheese, maybe 3 times a day. I don't know.
Maintaining that well-rounded diet is key. And like Tami has made mention in the past, you have to, move it or lose it. It's very important. Activity and keeping a lot of different assisted living facilities will have like a registered dietitian. So you need a meal plan and, absolutely, you got to eat nutrition.
And even too, if you're still in your home, let's just say, like your mom was, she lived next door to you. Even if you're in your home, it's little things like, say they're eating watermelon before bed and they're getting up 3 and 4 times a night. Some people metabolize watermelon differently and it's all water. So it literally gets them up throughout the day or throughout the night when they could eat it earlier, still have their nutrition and still have what they want, but it's not interrupting their sleep. We also look at the drugs they're on. So he was mentioning the SSRIs. Sometimes if they're not sleeping and they're having anxiety or depression, we might, as providers, start them on a different drug at night, which does both. We have, I use trazodone a lot in my geriatric population because it is an antidepressant on its own. It also helps initiate sleep. So instead of adding 2 drugs on, you're getting 1, and we may fix the problem within itself. So it's very complex, and that's the reason, as a medical provider, I wanted to bring him on for mental health issues. Because it does need to be looked at as a whole person, not just the heart or not just the mental health issues. So,
we were making a comment earlier about just the fact that it's so important to have the right professional at the right time. Like we had an elder law attorney saying like, well, you're not going to go to a heart doctor for brain surgery. You're going to get the right person who has expertise with what we're trying to tackle. And this thing about senior mental health, I'm sure the statistics are probably through the roof, that probably much depression is left undiagnosed because, like you said, it's the suck it up generation. I'm fine. I'm good. Just, but are they really? And so you are able to look at it both medically and also what's going on for them mentally as well. And then you're able to piece it together. I remember a story you told in our wellness series where you were talking about that you had seen somebody that was running 2 different medications. One was trying to help them lower the blood pressure, but then at certain times they needed another thing to help pump it up because it was dropping too fast. And your approach was to try to find a balance where they could maybe lose those things and just kind of bring it back to neutral. And that's part of it, isn't it? Is like to not over medicate, but to figure out what's really going on.
Another mental illness I wanted to make mention of that goes undiagnosed is ADHD. A lot of times adults will come and they've never been diagnosed, and that can cause a lot of anxiety. So with ADHD, you can have poor concentration, racing thoughts, and then compile that with transitioning to an ALF, let's say. We like to address the ADHD as well to help alleviate the anxiety.
You know, it's funny because as soon as you mentioned that attention deficit
hyperactivity disorder, yes,
you know, you hear about it all the time about kids, but we don't really think about that. Or at least I wouldn't, as just a person walking down the street, as a problem for seniors.
And there's a certain medication, guanfacine comes to mind. It started as a 1 milligram, and it kind of, if you have a lot of windows open, it kind of closes them down. It has a little sedative effects. It's a good medication for ADHD. Kind of calms everything down, calms the anxiety down as well.
Yeah, this is really why when Joe was talking about you have to have somebody that really knows their territory, because like I said, in the case, I thought my mom had a wonderful primary care physician, but the poor person was so busy with so many patients all the time that the best we were going to do is get a sliver of time. And so even, like I said, when it came down to let's give your mom this for depression, it was like taking a big hammer when maybe you could have had a much finer tool that might have been much more effective. I don't know if I'm saying that the right way.
Yeah. And not only that, but we can look at certain drugs. It might be just written, give it once a day. Well, if you're in a facility, or even if you're not, if the pharmacy gets that, they time those once a day in the morning, no matter what. If it's once a day, it's usually given in the morning. Whereas if you give Zoloft or certain mental health drugs in the evening, they will help you sleep. So it's 24 hours treating the anxiety or depression, but it can also help you sleep. So little teeny tweaks like that can actually make a huge difference, especially in geriatrics.
And I want to bring this up because you made it clear in the presentation you guys did for us and all the people here at the Senior Resource Center that it's not always the answer as a prescription pad. You guys have like a lot of programs that are very, I would call it holistic. You know, you're talking about meditation and other things like that. Talk a little bit about that aspect for the mental health as well.
Absolutely. We do aromatherapy, yoga, meditation, prayer, exercise, walking, really digging down deep and seeing what activities the individual enjoys. Gardening and many of the ALFs and such. So you got to find out what that person and incorporate that into their daily life. That's going to help with the depression. Being outside, sunlight, that helps with the depression. That we were talking before, human interaction. You know, we can't just, sometimes people move into an assisted living facility and there'll be 200 people there, yet they're still lonely. Maybe they're confining themselves to the room because they're anxious or depressed. So helping them, get out and mingle with other people and talk and share stories.
You know, I was talking about that it is fascinating because I've seen this with several individuals who really, you might have thought they were just happy being in their own little space, watching TV or whatever. And then they get into a good assisted living situation where they're getting their medication properly, they're getting their nutrition properly, and they're getting a socialization aspect that they really couldn't get at home. And then all of a sudden they're thriving. And that's really the point, is like, what good is having like a long life if you're not having a great life with it, right? I mean, and that's part of what you guys are addressing through what you do with this part of Senior Solutions Mind and Body.
Very rewarding. I love the follow-up visits. When they follow up and the medication's taking and the person's doing well, it changes the whole outlook on their lives. Yes.
So how do people get in touch with you? So is this something like I myself might call if I was thinking about this for myself, or do you usually find it's like a loved one or an adult child talking about mom or dad, or who gets involved in helping? Like, let's see if this is an avenue for us.
All the above, actually. So we do not need a referral from a primary care or a specialist, or the patient can call, their guardian can call, their children can call. Our number is 321-429-2677. And they can call and just, I have an office staff, they'll answer, ask them a few basic questions, and then it would be determined which one of us would go out first, so kind of thing. But yeah, we don't need a referral. Anybody can call us at any time, and we'll be more than happy. It may be a one-time visit where we just do the screening and give them the results. Or if we feel like they do need some psychosocial therapies, whether they're still in their home or in a facility already, and then we can encourage that to happen. And a lot of times And I've worked with Alex because he was a home health nurse for a long time before he was a provider. And his rapport with the patients are fantastic. So even if the family, say the son calls and wants us to go see mom, she may not be up for it. She may be like, but then once we get to know them personally. And so then once we get to know them, then they're like, we'll say, oh, we'll be back next week. And then we can actually get done what we're there for. But the whole thing is just to get to know them on a personal basis and give them what they need. Because like you said, it is quality of life, and they deserve that. So.
I was just thinking when you were telling that story, I was going to say, I would imagine, particularly because there is such a stigma about saying, I'm fine. I don't need any help. I don't want to admit to anybody I'm in trouble. I mean, it's kind of obvious if somebody's walking with a limp and you say, okay, maybe there's a hip, maybe there's a knee. We don't have a problem accepting that, but we seem to have a problem like, well, I shouldn't be depressed.
Right.
It's a stigma. And so I imagine a lot of times half of your job is sitting down with a person, getting them to acknowledge it's okay to be where you are. Let's work on getting you better.
Absolutely. Yes, sir. Asking the right questions is key. That's essential. Tami has a vast knowledge of resources in Brevard County as well. We want to empower the individual to live the best life that they can possibly live.
Yeah.
We also want to help their families because we do have a lot of families that live out of state.
Yeah.
And having that communication with an extra person, being a primary for as many years as I was, we don't always have the time to talk to that family member also because we're busy taking care of the patient, and especially when they're out of state. So, we can bring that extra layer, so to speak, so that it calms their nerves also, not just their loved ones.
And this is a benefit that's typically covered by insurance, right? I mean, this is talk a little bit about who should give you a call.
We do accept multiple insurances if we're out of network. We write that difference off. So whatever it would cost them to go to their regular doctor or, any kind of care like that, we run it all through their primary and secondary insurances.
So one of the things that I would probably want to ask you, Alex, is it must be very gratifying to you when you see the progress somebody's able to make when they're getting the right combination of therapies that are going to really improve life for them.
Yes, absolutely. That's truly rewarding. That's why we do what we do. Yes, sir. Sometimes it's hit or miss. We diagnose and we prescribe, and we always start low on the dosage to make sure the person, they take to it very well. At times we need to increase that dosages for the stage of life they're going through, but it's extremely rewarding. It changes their whole perspective. I mean, some people walk around life in a constant state of anxiety and they don't even know it. So with therapy and the medication combination, it can change their life.
And I guess really maybe a plea would be to say there's really no shame in the game to have the conversation, right? I mean, like we talked about, if it was a medical thing, if I've said this before, if I walked in with my arm in a sling, everybody like, oh, what happened? And be very sympathetic. And how long are you going to have to wear that? And it'd be all these questions of care. But when we walk in, we say, well, I'm depressed. It was, it's like we don't have the response we ought to have to that.
I think that takes extreme bravery myself. I truly do. There was a quote, I shared it earlier. Martin Luther King, he once said that it's not necessary to see the whole staircase in order to take the first step. So people are taking that first step into a staircase that hopefully leads to health and recovery.
Yeah, that's good.
It's brave.
That's good. That's good. And again, like I said, it has to be encouraging for you as you see people that maybe were feeling like they're just in a dark tunnel and they can suddenly see like there's light on the horizon and there's good out there again.
Yeah, absolutely. And again, with this generation, they're so stoic and they've been through so much in their lifetime, especially like my 90-year-olds, my centenarians. They've been through so much in their life. They're just used to being like, well, that's the next thing. I just have to keep going on. And they don't. We can make this last bit of life more full of quality than just them sitting watching TV all day.
That's good. We're talking with a couple of great folks from Senior Solutions Mind and Body. Tami Leeberg, who's a geriatric board certified geriatric nurse practitioner and the head of Senior Solutions Mind and Body, and Alex Thorpe, who has a very excellent background in all things psychiatric. And together, you guys are really able to address the whole person. It seems like it's as they say, it was a commercial that go, one call does it all. But it really is, it really is interesting how you are able to focus on really the seniors' well-being. And Joe always talked about that so much. I'm going to ask you to give the number one more time. And you have a great website, too. I want to make sure we share that as well.
Yeah, it's Senior Solutions Mind and Body. It's SESOmindbody.com. And our phone number is 321-429-2677.
Yeah. And, I think you cannot hurt yourself by taking the time to investigate all that's out there. First of all, as we've talked about, you can't find a solution to whatever it is that you're trying to find a solution for if you're not willing to invest a little bit of time. That's why we're so glad that you're tuning into Helping Seniors TV. Joe Steckler was always about getting ahead of the aging curve. We call it getting your ducks in a row. And we have these corollaries. We say, don't try this on your own. There's some wonderful help that's out here and available to you that really, this is what you guys do. They can't really throw anything at you that you probably haven't heard before and have some way of saying, okay, given this, let's try moving in this direction. It's why you got to call somebody. And then the other thing, the second corollary we say all the time is don't be an ostrich. Don't stick your head in the sand. You could be feeling so much better just in a few days because you took a step that's going to move you in the right direction and saying like, oh, I'm going to do that 6 months from now or something like that. I would say give you guys a call.
Call today.
Yeah, call today. Right. One more time, the number?
321-429-2677.
All right. Tami Leeberg, Alex Thorpe with Senior Solutions Mind and Body. Thanks for joining us.
Thank you.
That's the time we have for the Helping Seniors television show on today. Thanks for making us part of your senior educational journey. We'll see you next time.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.